Hi, everyone. I'm Jan Fox. I'm the co-chair of the Canadian Municipal Network on Crime Prevention. On behalf of the Canadian Municipal Network on Crime Prevention, I'd really like to welcome you to this webinar on the official launch of the Practitioner Guide on Crime Prevention and Community Safety and Wellbeing Planning. Long time in coming, but we're really excited for today. Before we actually begin formally with the program, I would like to respectfully acknowledge that I am joining you from Edmonton, Alberta, which is Treaty 6 territory. And I'm going to apologize in advance for anyone on the call who speaks Cree. I'm going to try to say the word for Edmonton in Cree, and that is Amiskoche Waskahaken, and that means Beaver Hills House. So Treaty 6 is a traditional gathering place for diverse Indigenous people, including Cree, Saulteaux, Blackfoot, Métis, Dene, and Nakota Sioux. I'm also asking you, and some of you have already done it in the chat, thank you so much, to join me and acknowledge the traditional lands that you are attending from. And so that we can recognize the past and present generations, elders, as well as the descendants and future generations of those Indigenous communities. This acknowledgement demonstrates commitment to beginning the process to dismantle the ongoing legacies of settler colonization, violence, and displacement through ongoing education and representation. While I believe that treaty acknowledgements are incredibly important, I also acknowledge that they're just one step towards reconciliation. And I think it's important that we acknowledge that we are all treaty people, our ancestors having been signatories. So I would like to just before we get into the meat of why we're here, I just wanted to give a little bit of background information on the Canadian Municipal Network on Crime Prevention. I know many of you are really familiar with us, but for those who aren't, I will just give a very brief overview. So the Canadian Municipal Network, as you can see on the screen, is a membership-based, nonprofit organization that serves as a community of practice focusing on supporting communities to prevent crime, increase community safety, and reduce violence. So to do this, we promote municipally or community-led multi-sectoral approaches that include a range of preventative measures and key sectors. So it's not all just about policing and the work we do, but we like to include those involved in education, health and social services, child welfare, Indigenous organizations, and housing. Of key importance in this is that prevention and community safety are not imagined as policing issues only, but as a collective responsibility, including multi-sectoral approaches and partners. And by that, we mean we look at this from a very balanced perspective. You'll see who we are. We're really proud of the rapid growth we've experienced over the last little while. We currently represent over 80 communities across Canada and almost 50% of the Canadian population. So we're very proud of training opportunities that we provide. In fact, we just did one last week over the course of 3 days, and that was on creating community safety plans in the rural crime prevention context. And we've done training also in crime prevention and community safety, where we've really stepped up our game in terms of providing webinars, especially during COVID, because there's been so much need and people are seeing so much gap in the community safety and well-being area. So we've offered a number of webinars, things like how to use data and indicators, safe growth through using crime prevention through environmental design, and a number of things such on specific program areas such as social disorder in inner cities, how people are going to cope with COVID going forward. We had webinars on how we envision our working relationships with police in view of the events over the summer. We also regularly create documents that are accessible to all members, things like action briefs, so that can help you when you're talking about promoting this kind of work with your elected officials. We've done practice briefs about cross-sectoral collaborations, for example, and many papers on topic summaries, specific themes, obviously community safety and well-being, and we've done community safety and well-being surveys that have fed into this work you're going to see later today. So over the years, we have had the opportunity to partner with many communities and organizations to help them with some of their community safety plans. And that includes Kenora, Williams Lake, the Alberta Community Crime Prevention Association, as you can see there, the province of Alberta, and that's the Rural Crime Prevention Project. We've, of course, partnered with Public Safety Canada, the Office of the Federal Ombudsman for Victims of Crime, and UN Habitat's Safer Cities program, to name a few. We're also involved with a newer movement called Peace in Our Cities. So as part of the webinar today, we're going to provide an overview of the Practitioner Guide on Community Safety and Wellbeing. This is our official launch. You will then have the opportunity to hear from practitioners about lessons learned through the development and implementation of their local plans in 2 communities, Burnaby and Red Deer. Thank you so much for taking time to be with us to present. Finally, you will hear about the forthcoming training opportunities related to the community safety and wellbeing plans. So without further ado, I'm going to turn it over to the wonderful Katie Cook from the network to present to you our new practitioner guide. Take it away, Katie.
Thank you, Jan. Appreciate it. Yes, as Jan said, I'm Katie from CMNCP, so I'm just going to try and give you a brief overview of the Community Safety and Wellbeing Practitioner Guide. All right, perfect. So as you can see, the project was funded by a number of different locations across Canada, as well as the Federation of Canadian Municipalities. So just to kind of explain what brought this about. So there's been this kind of growing emphasis on a more holistic approach to prevent crime and enhance community safety that kind of focuses on this root cause approach. And so we've seen this push for the development of crime prevention, community safety, and well-being plans from organizations and governments all over the world. So this includes the World Health Organization, the United Nations, and also the Government of Canada. And even within Canada, so the Government of Ontario actually mandated the development of crime prevention, community safety, and well-being plans in its 2019 Comprehensive Police Services Act. And so in light of this, a number of communities across Canada are either already developing these plans, have developed them, or are in the process of doing so. And so in order to support this work, CMNCP developed this document to kind of provide an outline of the processes that communities that have already done this have gone through, and sort of identify best practices and guide others in the development of their future plans. And so as you can see from the slide, this process involved 4 steps. So we identified communities that had completed the plans at least 50% of the way, and then we reviewed those plans, then collected some additional data on this process through interviews with key personnel involved in this process, and then finally we developed this report. So as you can see on the slide, upon review of the plans, we identified 4 key stages of development in the CSWB plan process. I hope you don't mind. Crime prevention, community safety, and well-being is a bit of a mouthful. So going forward, I'm gonna use the shorter version if that's all right. So I'll say CPCSWB. So just so you know what that refers to. So again, the 4 stages are pre-development, development, implementation, and evaluation. And I will speak to each of those in a bit more detail. So the first phase is pre-development, and this refers to work done in preparation for the creation of the plan. So there's a number of key steps within this phase. So the first one is actually going out and speaking with key stakeholders, which is really important for establishing and generating buy-in for the CPCSWB work. And it's important that this process involved individuals with backgrounds from multiple sectors, as this type of work involves taking a comprehensive approach, again, to address these root causes, because often this work overlaps multiple sectors. So we need to include individuals in this process that come from different areas. It's also very important to speak with different groups in the community to ensure that particularly vulnerable individuals, such as minorities, are given an opportunity to add input to this process. So in addition to actually speaking with key stakeholders from a variety of sectors and generating buy-in, a second important part of this step is actually collaborating with them. So developing these CPCSWB plans requires contributions from a broad range of sectors, as they require knowledge, experience, and input from all of these different areas. So this might include housing, education, poverty, etc. So there's a lot of intersection in addressing these root causes. And so not only is it important to get different stakeholders from different sectors involved in this process, but it's also important to collaborate with them all the way through. So one of the key takeaways that we identified from the review process was that many outcomes can be achieved through collaborative efforts that wouldn't be possible for a single organization on its own, which just reiterates the importance of collaboration. So this is a key step in this process. Something else worth noting is that we recognize that collaboration can be a very challenging process sometimes. And so we actually included in the actual practitioner's report, there's a full chart outlining a number of potential barriers to collaboration and different ways to address them. So you can see that in the full version. So in addition to communication and collaboration with key stakeholders, another important part is actually establishing an advisory committee that represents, again, a broad range of sectors that can guide this crime prevention, community safety, and well-being work. And so this is a highly valuable group, and it should be composed of a range of individuals with various skills, knowledge, experience, expertise, and resources that can be leveraged to support the plan and its development and ensure that it's effective and also relevant to the local community. And then finally, alongside all these great ideas, another important consideration during this phase is funding. So obviously you need resources to put these things in motion. And so the plans that were reviewed were primarily funded by the municipalities, although a couple had received federal funding as well. Some of the locations kept the work in-house and others outsourced it through requests for proposals and then ended up hiring an external agency to support the work as well. So depending on the resources available and who's at the disposal of whatever organization is doing this work, there's different routes to take here, but the key point is that these are things that should be considered ahead of time so that in moving into the next phase, you're aware of where the resources are coming from and what is available. So that's the pre-development phase. So the second phase in this process is development, which involves preparing the actual CPCSWB plan. So one of the most important steps in developing a crime prevention, community safety, and well-being plan is conducting a community safety assessment. And so this involves actually going out and collecting information on the community. And so this includes several forms of information. So quantitative data is essentially numerical data. It can include things like crime rates, graduation rates, demographics, things like that. So it could be collected from Stats Canada, for example, or other sources in the community. There are other forms of quantitative data that can also be collected during this process. So for example, CMNCP actually has a community safety and well-being survey with a full topic summary that is actually on the website, but that can be used to identify sort of what's going on in the community at that time. So that's another way of collecting quantitative data. In addition to quantitative data, another aspect of the community safety assessment is asset mapping. And so basically this involves identifying services and supports that are already available in the community and where they exist. So what this allows is not only to identify the strengths of the community and what they already have going, but also where there may be gaps in services and to avoid duplication of services. And then finally, another important part of this assessment is community consultations, which are essentially focus groups conducted with segments of the community to understand their perspectives from a local lens. So in its own practice, CMNCP emphasizes the importance of holding consultations with specific groups in the community, particularly those who are more vulnerable, to ensure that their voices are heard. So for example, groups like seniors, women, the SLGBTQ+ community, newcomers, and so on and so forth. And so just to clarify, this is different than holding general town hall meetings, which do bring out information, but something worth noting is that they tend to privilege particular individuals and may prevent the representation of other voices like the groups that I just mentioned. And so as a result, you may want to consider this in your own work. Another important part of this phase, so development, is identifying priority areas and how to address them. So collecting all this data from the community allows plan developers to then figure out, okay, what are the key issues or key challenges that this community is facing, and determine the key priorities that the plan should be addressing. And then following this, once these priorities are identified, the next step is actually coming up with strategies and actions and ways to address them. So the focus here is to actually develop a plan of how to address the key priorities that were identified from the data collection, and then ensure that going forward there's an approach to actually ensure that they're addressed. And then finally, while the evaluation process actually occurs much later on in this whole process, of course, something that is worth noting is that it should be considered earlier on. So for example, you might want to think about things like what's going to be evaluated, how, and what should be put in place to ensure that this can happen. So for example, you may need to collect baseline measures to allow change over time to be assessed. So that is the development phase. The third phase in this process is implementation, which refers to actually putting the plan in motion. And so based on recommendations on how to address the priorities established in the previous phase, the first important step in this process is determining, okay, how are we going to implement, or how are local programs going to be implemented to address these? And so a key thing to note here is that one of the things that we found when we reviewed all these plans is that there was a very broad range of local programs that were used to address the priority areas identified in the different plans. And this really highlights the need to identify local considerations and make sure that these plans are tailored to the community that you are implementing the plan in. And it also reiterates the importance of collecting local data to really ensure that the information guides this process and is applicable to that community. Another key step in this phase is the ongoing communication and monitoring of this plan. So this ensures that as the plan is being implemented, all stakeholders, and this includes residents in the local community, remain aware of the plan implementation process and how it's affecting the community. So you can keep track of the positive impacts that it's having and potentially also where things may not be occurring as expected. And this provides an opportunity to make adjustments if there are unintended impacts or even celebrate milestones within the community. So it ensures ongoing monitoring, ensures that we can, or that anybody involved in the plan process can respond immediately instead of waiting too long and finding out down the road that certain aspects aren't effective or not necessarily addressing the priorities that they're supposed to be addressing. So that's the implementation phase. And then the final phase in this process is the evaluation, which involves assessing the work that's been done and examining its impact on the community on the longer term. So something worth noting is that among all of the plans included in our review, only a few were actually at this phase, so the data is limited. But that being said, we still identified some key findings that are worth discussing. So one of the key aspects of the evaluation process is identifying key questions to address in assessing the impact of the crime prevention community safety well-being plan. So these questions might be things like, how is the plan impacting a particular group in the community? Or what impact is the plan having on a particular priority area? So again, just different things to consider and questions that might want to be examined in this process. Another important part of the evaluation process is establishing what will be measured to assess the impact of the actual plan itself. And so generally this is done through the use of indicators, which are observable, measurable pieces of information about a particular outcome that allow us to determine if the anticipated effects have occurred over time. So there are both quantitative and qualitative indicators. So quantitative indicators, again, could be something like crime rates. So you could look at the crime rates at the beginning of the process and at the end and see, okay, have they changed over time? And qualitative indicators could be something like community perception. So how did people feel about walking alone at night in their community prior to the plan implementation, and how has this changed, or has it changed since the plan has been implemented? And as Jan mentioned, there's also a topic summary on indicators available on CMNCP's website as well. So there's more detail into that and a lot of suggestions and different examples of indicators if you'd like to look at that. So the point here is that indicators are used to examine the effects of the plan implementation by measuring the changes that have occurred over time. And then finally, based on these measurements that are identified or that are taken using the indicators, plan evaluators can actually assess its outcomes so that they can identify which priority areas have been impacted and if the desired effects have actually occurred. And at the same time, they can also identify areas that may not have been addressed effectively, allowing additional steps to be taken. And so by understanding what has happened thus far through the evaluation process, the community can continue to implement plan elements that are effectively addressing these issues and adjust those that may not be achieving the desired effects, or even add additional elements to assess or to address areas that may have been overlooked or haven't been effectively addressed. And something just finally worth noting is that through this process, evaluation, there might be certain things that are noticed. There might be other aspects that take longer to occur, and some of these effects won't necessarily be identified right away. So it's important to be aware of that and cognizant of that. And so not to just assume that it isn't being effective just because, within a short span of time, change hasn't been seen. So that's something worth considering. So that's a very brief summary of the practitioner report. Obviously, the actual thing itself goes into much greater detail, but that's kind of the key findings that we found in this process.
Thank you, Katie. Thank you. Welcome, everyone. I'm going to take over from here. My name is Felix Munger. I work for the Canadian Municipal Network on Crime Prevention, and I'm joining you from the Waterloo region, which is the traditional territories of the Haudenosaunee, the Anishinaabe, and the Neutral people. Couple of comments before we just jump into my shameless quick little plug. But in terms of the report that we developed, this was an idea that we had a while ago when we were starting to see that more and more people were trying to create these kind of plans. And so we thought, well, the best way to do this is if we ask around. And so it's not so much about what these plans should look like, but rather really thinking about what's the practitioner perspective, what does it look like if people develop those plans? And this is what we came up with. I want to really make sure that it's clear that this project wouldn't have been possible with many of our members that were willing to contribute to this particular project, both financially, but also the people that talked to us, to one of our staff during interviews. The report in itself is on our website. We will send a link to participants after the webinar with a link directly to the actual report. Also forthcoming is kind of a toolkit, which brings the sections in more detail to light and allows you to do a little bit of check marking and note taking in your own process for any of the communities that may be embarking on this process. It is at this stage, in a lot of ways, the report and the toolkit is based on kind of what we've experienced so far, what we've learned so far. And obviously, we're not claiming that this is in any way perfect, but it's the best information that we were able to find at this point in time, putting it together and trying to figure out a way that is useful for people to use. I'm assuming many of you are here to hear about what does it look like from practitioners, and we've invited this time around two groups of practitioners to talk to us a bit about both the planning process in this case. So we've asked David Critchley from Burnaby, BC, who's the Director of Public Safety and Community Services for the City of Burnaby, to talk to us a bit about his experience of developing the plan, which I think a couple of months ago was published. And then Kerry Thomas, who is the Program Coordinator for Community Safety for the City of Red Deer, together with Jeremy Vo, who is the Supervisor of Community Safety, also for the City of Red Deer. We'll talk a little bit about the implementation. Red Deer has had a plan for quite a while, and we're quite interested in hearing, and we thought it would be good for someone to also talk a little bit about what it looks like when in the implementation phase. So I think we're ready to go. Over to you, Dave.
Well, thank you very much, Felix. And before I begin, I'd like to take a moment to recognize that I am on the ancestral and unceded homeland of the Hunkaminam and Squamish speaking peoples, and to extend appreciation for the opportunity to participate in a meeting on this shared territory. Now, Felix, thank you for that. And I am mindful of the time, and I want to make sure that I don't run long. So I will apologize in advance if I'm going quite quickly. Normally on our community safety plan, I tend to speak for over an hour, on the presentation. So I'll go very quickly, and then of course we can answer any questions that come up. Just to set the stage a little bit, as Felix mentioned, I'm the Director of Public Safety for the City of Burnaby. And in Burnaby, we have about 240,000 people, and we're part of the Lower Mainland in the Greater Vancouver area. So we're not really an island, we're in the middle of a very large population base of approximately upwards close to 2 million people. And the RCMP is our agency that delivers the police service for us. And I think that's important because each municipality will have a different model of police service delivery. And for us, it's the RCMP. And of course, the RCMP being a national, provincial, and federal and municipal agency, with it comes some restrictions. And then I just wanted to note, of course, this is a very exciting time for all of us in community safety, and the environment of providing safety for our citizens and policing, as we all know, is a very dynamic environment, and we have the opportunity to make a big difference. So it's exciting. And what I'll do is I've broken my comments up into 3 areas, just following on what Katie had noted, as the stages on the plan. I'm not going to use any slides, but I'll just share briefly some of the experiences. The first one is before we actually got the plan going. And the next is when we set about actually preparing the plan, creating it, and then implementing the plan. And we are in the middle of our implementation. As Felix noted, it was approved substantially with council a year ago. But, and I hope I don't say it too many times, but with COVID, of course, all things got impacted, including our plan. So we actually got it published and implemented it for the summer of 2020. So essentially, we're 6 months into our plan. So as I talk about before we created the plan, one of the key things for us, of course, was to get mayor and council on board, make sure that they're aware of it, because it's not my plan. The plan goes out on behalf of mayor and council. They're the ones, the face of the community, our elected officials that use this plan to explain how they are working to enhance our safety in our community. And of course, in my role as the director, our mayor looks squarely at me and says, what are you doing to enhance the safety in our community? So this plan is instrumental. This is my guiding light. This is our document that we use to show all the various things that we're doing. So that's key. They have to know what the plan is. They want to be a part of it. And as I say, they're the face of it. In our plan, you'll see their picture is the 3rd page in. And then, of course, resources are always key. We don't have any dedicated resources specifically for this plan within our department. And you have to have a key committed internal team. So 3 or 4 people that are absolutely embracing this plan and looking to deliver it. Execution is always the challenge on a plan. Anyone can build a plan, but you got to be able to execute it. And it's absolutely key that you have that team that's going to be with you throughout all of the various phases of the plan. In addition, what's very important as well is the external group of, I call them our key clients. We have half dozen to a dozen external clients that we engage with constantly throughout the various operations and mechanisms of the city and our citizens. And just like the elected officials, we got them on board before. We talked about what we're looking to do and got their buy-in, and they're with us as part of this journey. So it's not just, coming from the city as a bureaucratic process, how we deliver this plan, but it also has our key stakeholders in the community involved. And as some of you may have seen on my bio, I come from a policing career. And so with that, I'll acknowledge right off the bat is that I have that background, which I don't turn a blind eye to, but I try and use it to help facilitate what we're doing on our community safety plan. And it's an interesting time in policing, as I commented on. And key before we started the plan was meeting with the senior executive of our local police detachment to make sure that they were on board as well. The RCMP, of course, has a very robust planning system and their own corporate comms, and they have their goals and priorities, and we had to align ours to make sure that we could work together. And it's key that we have police engagement and buy-in. And then my last point on before we started the plan was their corporate communications. In hindsight, I would have engaged them much earlier. And I know that, of course, corporate comms for municipalities will depend on the size of your municipality. And for us, we're fortunate that we have a fairly robust comms team. And I should have got them involved earlier to help engage the public, to get greater participation and have the consistent branding and marketing throughout the entire process. And I'll touch on a little bit more of that as we created the plan. Now I'm going to transition into talking about creating the plan. And I say this with a smile on my face, and I'm mindful we have a lot of people on. This is public, and I say this with a sense of our elected officials is now that they're involved, you have to be prepared to foster that involvement and keep them involved. And we started creating the plan. We had a workshop with them and talking about the various initiatives. And at that point, of course, now that they're involved, that takes a lot of effort because everything that occurs on the plan, they have a keen interest on, and they will refer back to it constantly. So that's a relationship that for me, I didn't anticipate having to spend as much time as I do with our elected officials on the plan. And like with any council, you'll have varying degrees of interest and participation, but there is certainly from our mayor and council significant interest and participation as we created the plan. I touched on community engagement. We are very fortunate that we have in our community, we have really, it's broken into 4 town centers. So each town center has a community police office. We have rec centers and libraries. So we used each town center as kind of the hub for community engagement. And we had open houses and attended at various fairs and events. And we did a survey and we did a whole bunch of things to get the community involved. And what we did as we were creating the plan is we engaged the consultant firm. And in the hindsight, I think there's an appropriate place for getting assistance from an external agency consultant to help you ramp up and build the plan. However, it was a challenge to make sure that the work that we received back from them was something that the city could use and own. So in other words, it had a Burnaby feel to it. We spent a lot of time converting their output into the Burnaby feel because we're immersed in our city, whereas the consultants aren't necessarily immersed in it. So in hindsight, again, that's back to our own corporate comms where we could have engaged them much earlier to not have to redo the work. So that was key for us. I'm not saying not to use a consultant. They were very beneficial, did great work. It's just ensuring that it's ingrained into your system and it's reflective of what your city wants to portray. The next point I had was our number of initiatives. How many is too many? We have 5 priorities with 31 initiatives. So those are 31 activities that we now have to track and report on. Now that is a lot. And I don't know that I would say for us it's too many because they're broken into various components, really 3. Some of those initiatives were already underway when we created our plan, but they didn't really have a home. So we brought them into the safety plan to have a home and report back on. Some we had to create from scratch, and some we know that we want to create. So we're not necessarily starting 31 from scratch and working on all 31. But for us, that seemed to fit within our 5 priorities. The next point was choosing the initiatives. And on some of the initiatives that we put in the plan, we don't own them. In other words, I don't have the ability to actually push those initiatives other than by influence. I can't assign resources to it. I don't have direct hands-on control. And in hindsight, I might not have included a couple of those because I don't have that control. And I don't mean that from any sense of grandiose. It's just if you're responsible for a plan and reporting on it and you cannot control what you're reporting on, that can be problematic. The reporting piece is And I talked to Felix about this when he was out in our neck of the woods, and the challenge of how to report back on some of this. As we all know, anyone involved in public safety, it's the sense of feeling safe. How do you report back on the sense of feeling safe? You know, you got your surveys, and it depends who you ask, you know, and where you ask, and how many times you ask. So that's a very tricky one. Not to be undernoted, that does take some time. Nimbleness, the ability to change the plan in flight. We didn't have the pandemic as one of our initiatives when we started, because it didn't exist as we were creating this. And all of a sudden we get hit with the pandemic. And as I was presenting the council before we were doing our workshop, I didn't even have the pandemic in the presentation. And I said, this is crazy. I have to include it. You know, how are we going to keep our community safe, and what's our role, and what can we influence? So we added very quickly added an initiative in there. So my point on this really is just being nimble and upfront, that as you go through the life cycle of your plan, there might be some initiatives that are no longer relevant, that you might not focus on. And conversely, initiatives that come out of the blue. And then the idea of it, you know, the plan and the initiatives are not absolutely cast in stone, but it's a collection of activities you're undertaking to enhance the safety. Now, very quickly, and I know time is tight, implementing the plan, I talk about getting the light. You know, how is it that you can stay relevant? There's so much going on. There are so many plans underway. Every department has their own initiatives within the municipality. There's so much going on. How do you stay relevant? And in my view, you do that by constantly being out there. It has to be talked about. It has to be current. And you have to be prepared to speak to the plan. What surprised me is on the number of occasions that mayor and council or other organizations such as our Board of Trade or Simon Fraser University, they reach out to me and ask me to present on the plan and what we're currently doing. So once you create it, you have to stay with it and make sure that you're current on it, because there's a great appetite to hear about it. The reporting I already talked about is we have our first reporting cycle that we're working on now, and we report out every 6 months. And that is a tricky one, trying to find the sweet spot for that one. So I think I'll end there, and just with a couple of closing remarks is quite simply, I'm glad we did it. I wouldn't look back and say, geez, I don't want to do this. I think it's absolutely relevant, and every community should do it. And the continuous effort that's required, it's not a start and a stop, it's a continuous journey. Talk about making history. I think we're all making history here. You know, this is a new initiative in how we work collaboratively with all of our agencies, not just the police, but all the departments within the city and outside the city to enhance our safety. And we have to celebrate our gains and victories. You know, take a moment and say, geez, we did something. We've been successful in completing this plan. Creating a plan and undertaking initiatives. And I'll end there with good luck to everybody. And if you have any questions, I will, of course, be glad to answer. My apologies, I'm watching the clock because I want to leave time for my colleagues to speak as well. Thank you, Felix.
Thank you so much, Dave, for that. I think it really puts into perspective, you know, we present the practitioner framework, which is very much kind of about the theory around developing these plans. And it's really great to hear from someone that can talk about what that process looked like, and what you learned and what you would have done differently, and what worked really well. And I think that's so valuable for everyone on the call who maybe has started or is starting to go down this path. So thank you for that. I think maybe what I'll suggest, just because we are a little bit short on time, is that we'll do questions at the end. If the presenters are available to stay on for a couple of extra minutes at the end, maybe we'll do that. And for now, we will go to Jeremy and Carrie to speak to their plan development and implementation, just to make sure they have time. So on that note, I will therefore introduce Jeremy, who is the Supervisor of Community Safety for the City of Red Deer, as well as Carrie Thomas, who is the Program Coordinator of Community Safety for the City of Red Deer as well. So over to you both for your presentation, and thank you so much for being here.
Thank you so much for having us. I'm just going to make sure that our PowerPoint can be on the screen. Are you seeing it?
Not quite yet. Make sure you share the.
So I've got it up.
It's just not shared on the Zoom end yet. Oh, there we go. There it is.
Okay, excellent. So thank you very much, and thank you for that introduction, both Audrey and Felix. My name is Jeremy. I'm happy to be able to present to you today, along with my colleague, Carrie Thomas. Together we make up the community safety section within a new department at the City of Red Deer, the Safe and Healthy Communities Department, which is a intentional focus on ensuring that our city resources are appropriately going toward these priority areas, which include housing and homelessness, community development, community safety, and recreation. I will move quickly through this as well. So like many communities, Red Deer has prioritized community safety, and we are not alone in dealing with things like downturns in the economy and the increase of negative impacts to community safety, real and perceived. We also found ourselves with headlines we didn't want and positioned in Maclean's magazine's crime index that we didn't, were very complimentary. So similar to Dave's comments, we were tasked with coming up with a change. And so our council strategic plan, actually their last two strategic plans, speak specifically about being a safe and secure community, strengthened through enforcement, prevention, intervention, and education. We also adopted a social policy framework in 2015, which sets the guide for how we focus our efforts on factors that affect and support well-being. Both guiding documents have positioned us well to address this priority and led to work on our community safety strategy. So a little bit of our timeline here. You can see we formally turned our attention to this to get to today back in 2014. 2014-15, we saw the creation of an ad hoc committee, and we did our community safety survey. And that led to the adoption of the City of Red Deer's community safety strategy. And this was a document that was formally adopted by council, our city council. In 2017, we returned to some targeted community consultations, leading to the formation of what we call our systems leadership team, and I'll talk about them in a moment. This team formally adopted the 2016 strategy as their guiding document. We did our community asset mapping and a community safety summit in 2019, which really confirmed the direction and the priorities we needed to go. And since then, we've been working on coordinating and developing and implementing identified priorities, and we'll talk about those initiatives as well a little later in the presentation. So you can see this has taken us some time. Patience was key as we embarked on this journey, weighing the interests of elected officials, institutional or system leaders, not-for-profit agencies, and citizens. So our systems leadership team is made up of the representatives that you see on the screen. We have a wide representation of a variety of involved organizations that are really central to achieving these goals. They are the highest level of representation we have in each of these areas, save for minister level at the provincial level. And they really are the right people around the table. They provide influence and direction and have really shaped the way that these initiatives have come underway. I'm going to turn it over to my colleague Carrie now to talk about the safety strategy itself, and I'll turn it over to you.
Thanks, Jeremy. I would actually just like to loop back a little bit to expand on our timelines. So I'm going to take you specifically back to the fall of 2018 and coming into 2019. From that point forward, we really started to look at how do we start this implementation of this community safety strategy and what pieces did we really need in place to do so. So starting in the fall of 2018, our systems leadership team committed to doing some face-to-face consultations with our collaboratives. We call them community collaboratives in our city, really looking to engage back, validate our previous or existing community safety concerns, as well as a personal invitation for those collaboratives to attend a summit that they hosted in June of 2019. Jeremy, could you chat for me? The slide for me. There we go. The purpose of our day then was really to inspire that community engagement and some coordinated action to start to strengthen and sustain our safety goals in the city of Red Deer. So we really needed to focus our day around education, prevention, intervention, and enforcement, and the activities and the programs that were taking place. So through that summit, we had the pleasure of hosting or having Scott McKean, our very own Scott McKean, come and keynote our day. Scott really focused on the fundamental components of an effective safety strategy, as well as some of his own personal experiences and his journey of working in the city of Toronto. So we were really excited to have Scott join us for the day and take part in all kinds of different activities that we ran. So through the day, we ran things like solution labs, we had short conversations, we had priority setting exercises. But what I really wanted to highlight in this slide is we started our day with a web exercise to really look at specific situations for people in our city when they're trying to access help or services within the community. So what you see there is web. We had 3 or 4 balls of yarn, and we were reading out a very normal type of case scenario of people trying to access services. And we had people stand up from their agencies when they could help. So a statement was read, and when they could help, the yarn ran across the room. So what we ended up with after 4 balls of yarn was quite a spider web. And we were using that to really illustrate how we as a community really needed to start looking at our resources efficiently and effectively to respond to some of our complex situations in our city. Thank you. Next, Chair. The results from the day really came in stages. We had the feedback from the community and the actual summit. We had some consultations with SLT. And then a department at the city, our social planning department at the time, took all the information and we started to compile that. So at the end of the day, we had 100+ people attend our safety summit. Throughout the day, 33 community priorities surfaced. And those were the common priorities. There were probably many more than that. The second stage of that is we took those 33 priorities and we had a retreat day with our systems leadership team to really look at that creation and the implementation for our plan moving forward. From there, what we really looked at throughout that day is that we really needed a vehicle or a model. We had a plan, we had our priorities, but we really needed a model of some kind to really look at how do you coordinate in your community, how do you communicate, and how do you implement when you're looking at agencies, systems, programs, services, and how do you focus on those priorities. So from that point, the SLT were able to look at that and came out with 4 key action areas and 6 key priority areas. The next stage of that process was the SLT hosted an open house in our community where we talked about the results from the community. We emailed out the feedback report. We asked for feedback, and we really looked for some consolidation or some agreement to this type of community integration model that you now see in front of you. So to speak a little bit to the model that we introduced to our community, we looked at where our systems leadership team sits and what their role is. And that really is that strategic planning and oversight to really sustain your community alignment around community safety. The second box you see there is the community integration team. What really came out of our consultations and our conversations is that we needed a team to interface, to integrate, to really look at what SLT priorities were and try and get those to the boots on the ground, so to speak, or your community collaboratives. So the role of the CIT became that operational planning and coordination of safety concerns and really looking at development of plans in tandem with our community agencies, and then working with our collaboratives to move that work forward. So through that, our community safety action areas will probably maintain as our 4 action areas. We have learned that you can move those priorities in and out of those action areas. So system innovation is really a challenge for community change. How do you forward that? our first priority area was creating that community integration team and a central coordination model. The second part around people-centered approaches came out loud and clear from our community and from our summit, that we really need to get back to being more people-centered and have more of a people-centered approach. So looking at that right resource at the right place at the right time for our citizens. Community mobilization as a large action area is really that everyone has a role to play. Whether you're an agency, a system, a citizen, really focusing on that everyone has a role they can play and how you move that forward collectively. And resource coordination is really the creative use of shared resourcing. With things like COVID and safety concerns, we're always looking for innovative ways and really promoting those conversations around data and information sharing and funding innovation. So that essentially became our community integration model as we start moving forward. So sorry, Jack. So how do we do that? Our priority areas that you've seen on the previous slide really have molded where our current initiatives are as a community. So just recently, we have launched at the beginning of January 2021, our social diversion team, which I really need to put a plug in for Edmonton and Reach and the crisis diversion team. Just an unbelievable amount of help as we navigated the waters around how we can create and implement a team for social diversion for our most vulnerable population. So that has launched in early 2021 of January, and we had approximately 80 calls for that social-based service already. Through that, we've added a link in there if you'd like to check out our press release and information about the diversion team. Jeremy's added that in. A second initiative that came out of those people-centered approaches was the need for some trauma awareness and really looking at how you build resiliency in your community. So when we started exploring those needs and having a more trauma-informed workforce or a trauma-informed community, we really looked at our online learning platforms and how can you get this information out there and people utilizing it. So we have created a program that we've also created a link for you there that takes you to our online, what we call stage 1 training. We have just started as of Monday, our full day stage 2 trainings. And the purpose of that is to start building common language across our community around trauma and your role in trauma or your personal experience with trauma and how we can use that common language to start building a more resilient community around the right resource at the right place at the right time. And lastly, one of our major navigation programs right now is through the use of Help Seeker. And I know some of you are also using Help Seeker across the country. A major theme that came out of the Safety Summit was difficulty navigating services, especially during these online types of times. So that's just a couple of examples, and Jeremy or I could definitely give you more information on those if you'd like. Thank you.
Thank you, Carrie. So just getting to the lessons learned piece, and I'm aware of the time, and we'll get through this here. So some of the key things that we've really learned over the last couple of years as we've gone through to implementation is that we really need to integrate our data and communications efforts at the beginning. Dave talked a bit about bringing in corporate communications. We've had that support, thankfully, at the City of Red Deer. We need to expand that to coordinate with our system partners so that we're speaking with one voice and sharing that responsibility for communicating to the public. And also now, I think like in a lot of ways, we chase the initiatives a little bit and we've got a lot of data coming in, but we really need to streamline that with our systems partners as well. We know funding innovation will be a challenge. Not everyone can just cut a check and say, hey, do this project. We need to get this going. It has to be about focusing investment in shared priorities. And so not everyone's going to be able to just cut that check, but they need to be able to invest in initiatives that will support these shared objectives. We also have been talking a lot about how are we going to report success back to the community. We've been through this process for a while now, and do we want to report back on safety in general and the overall sense in the community, or just on the activities related to our systems leadership team? And the other big takeaway that we've had is we've had a real strong approach for systems integration for safety, but we also know that these are the same systems players for addictions, mental health, housing, and homelessness. And so finding a way to expand this conversation so that these other areas can benefit. I'm going to move on to our next steps here quickly. So we are, as you saw, we've got some initiatives underway that achieve some of those goals. We're really going to turn our focus to enhancing our communication and sharing our data across the systems and with the community. We've got a data working group that's going to be taking this on. We really are going to start tackling funding innovation to make sure that we can take on a long-term approach to ensure sustainability for funding, and really building up the community integration team. They are the backbone of services and systems, and they are the ones that have had so much great influence on the actual implementation of the initiatives. And so I just leave that, recognizing the time, and certainly to your request, Audrey, we're available to take any questions after this presentation. Thank you very much, everyone.
Thank you, Dave and Kiri and Jeremy, for this really great presentation. I'm sorry for squeezing the time a bit for you.